Dr. Grainne Fadden is a clinical psychologist who has influenced organizations worldwide to incorporate families routinely into mental health services. And she has a lovely voice when she's willing to sing.
Thank you for, I suppose, keeping to the spirit of what collaborative practice is about. I know right from the planning stage when we met with you first last year, you were very keen that the planning group represented the whole of that triangle of care, that there were family members and consumers and professionals involved. And so I think you acted out what you're speaking about, which is in the real spirit of what we're trying to do. And I think the fact that you have had the first keynote address on collaboration, on that collaboration again is a measure of how much you value that. And the fact that David and I are going to try and model this, the fact that David is a family member who's got a daughter with psychosis, and I'm here as a professional, and David's also a GP, so we've got that primary care and secondary care interface. So we're trying to model again what the whole conference is about. We want to talk about how to establish triangles of care and to get that true collaboration going. We are an organisation or a group who try to bring about organisational change and do that through a variety of ways, and we do a lot of training and a lot of consultation with organisations to try to bring about family-sensitive practice, services that meet the needs of everybody who comes in contact with us. And we are an NHS, a public organisation, so it's not a private group. We work in the public sector in the United Kingdom, so we're monitored by the usual NHS structures. But we want to keep families, I suppose, at the heart of services, and I suppose we don't apologise for emphasising that, because for so long families just didn't feature at all. That's what we're about. So I've put that primary and secondary care interface in because actually for a lot of people with mental health problems, of course their first port of call is their family doctor. They don't come directly to us, they come through primary care. So obviously we need to work with primary care services so that they understand how to identify people and how to support people. And sometimes primary care workers aren't quite sure what to do. For example, if a mother comes along and says, I'm worried about my son, but he won't come to see you, he's not leaving his room at the moment. It is quite a challenge to know what to do. So you can see already the need for secondary care and primary care to work together so that we can together think what's the best way to deal with that situation so that that family gets support. The whole concept of triangles of care and collaborative practice, which is what this conference is all about, professionals, those with lived experience of mental health problems, and their supporters, those people in their circle of support, which is sometimes blood relatives, sometimes extended family, sometimes a group of friends, neighbours, whatever it is. Again, as one of the main components of collaborative practice is about understanding what is it that we're here for and prioritising need. There are a lot of people who present with a whole range of problems, and we also work in an environment that has economic constraints. So I think we do need to be clear, what is it that we need to do in secondary services? What can be dealt with in primary services? Where do you need collaboration? What can be addressed by voluntary organisations in the community who do other sorts of work? And I suppose that the idea of each group knowing what is their priority, what are they best at doing, and when can they pool their resources for the best effect. Each organisation needs to know what it is their priorities are. That's what we find in a lot of services, that what people complain about in the first place is not the fact that they don't receive particular types of treatment, but it's about the way they are treated in services. If you look at complaints to organisations, particularly or especially mental health, and that's the one that I know most about, generally the complaints are about how somebody was spoken to, the fact that people didn't return calls, that they made offhand comments, dismissive comments. It's all of those kind of the nature of things that are just ordinary humanity. And the question we suggest people ask always is, if this was me, what would I want? Or if this was my relative, would I be happy with this? Or would I be happy with the way I've just been spoken to? And if you can continually come back to that question, I think it will keep you on the right track. Again, some of you may have seen this inverted triangle before, but in a lot of our services, family members are not routinely involved. So they are in child and adolescent services, and then to a lesser extent in older people services, and in adult mental health services it's not great, and then in forensic services it tends to be maybe more restricted again because a crime may have been committed in the family. So this is another triangle, but I suppose this is a triangle we want to turn it into something else, don't we? They want help to understand the service maze, what they describe as a very complicated system that they can't make sense of, especially if it's their first contact with that service. They want effective treatment for their relative. That's the most common thing that people ask for. And when in the approach that we use, part of it is to ask family members, what do you want for yourself? Part of it is about people setting goals for themselves, for relatives setting goals for themselves. And so often people just can't think of anything. They just consistently say, I just want my son or daughter or my husband or wife to be better. And you say, what about you? And they say, nobody's asked me that for years and years. In our program as well, I can remember a mother whose son was, he lived with her, she was his main supporter. He had no issues with her being involved, and she contacted the team about something, and they said, we can't talk with you because of confidentiality. And she said, what confidentiality? What do you mean? And her son had no issue, and yet this was the professional involved created a problem. So it's not unique to you that when you're starting off looking at working in this way, these are the issues that are there. Things are working in their area rather than looking at the pathway, as David was describing, the pathway of that family or individual. And I think in the training traditionally there was this sense of leading clinicians to think they know what's right for people and their families. And I think, again, the really live example of that we've come across here in terms of what you've been telling us, and as I said, we have come across in our work as well, is even where the consumer says they're happy for the family to be involved, the professionals think they know better, and that somehow isn't in the person's interest. So I'm going to end with this, which is one of my favourite Irish expressions, which is from my agricultural background. You see, I grew up on a farm, but basically, that you'll never plough a field by turning it over in your mind. Don't just stick with thinking. Get on and do something, and do it quickly.